6:30 on News Channel 6.
Dr. Joseph McEvoy is a tenured professor of psychiatry and health behaviors at Augusta University. He also serves as the director of public psychiatry at East Central Regional Hospital. He has extensively researched severe mental disorders like schizophrenia and bipolar disorder and has authored more than 170 papers and chapters on the subject. I know that the Medical College of Georgia at Augusta University is so pleased to have you, and we're pleased to have you here today. And the reason that I've asked Dr. McEvoy to be here is to talk more about bipolar and treatment for it, because you know what we've heard is very scary, and I want to leave our viewers with a sense of hope and what treatment can mean. So I want to ask you a couple of things.
Sure.
And first of all, one of the things our guest before talked about was the uncontrollable spending, like $200 on Post-it notes. And how do you not realize you're doing that?
In a manic episode, people are just energized. They do things they would not normally do. It's the most dangerous time in many ways of bipolar disorder, because they will spend money that they and their family have saved. They will have relationships they never would have had in their normal life. They will get irritable with their coworkers, their boss. They will tell people all sorts of stuff that probably they just shouldn't say. It leads to great disruptions in their lives and is a very dangerous period. When someone comes in who's depressed and you're seeing them for the first time, it's really, really, really important to try to figure out, is this really a person with mania? Because if you just pop them onto an antidepressant, wish them well, you may flip them into a manic episode and have their spouse, their boss, suddenly having to deal with a different person who can be very disruptive.
That was one of the things she talked about in her book, was being treated when she was depressed and for depression, and it's more than that. She talks a lot about rapid cycling and says no one warned you about rapid cycling and how you feel like you're losing your mind from minute to minute. You go from being suicidally depressed to feeling like you're on top of the world. And I like this part, start projects, to spinning around then and being depressed again, wondering why you're even alive at all. So it sounds like you just go from, I'm going to do this, I've got it all together, and then you just spiral down into that abyss.
Bipolar disorder is biological illness like high blood pressure, like sugar diabetes, and as clinicians, your goal, what you like to have, is to catch it early, to have a patient who's willing to work with you, to be conscientious in taking care of her or himself,
Right.
to have family support. You know, so you need to make the right diagnosis, to get them on the right treatment, get them into remission, and keep them there. Unfortunately, that doesn't happen as often as it should. People are misdiagnosed as just having depression, given an antidepressant, which may make them feel worse. And then they'll see another psychiatrist who will do the same thing. On average, it's several years before someone with bipolar disorder is correctly diagnosed. So as you can readily understand, I think, in high blood pressure, if you're not getting your blood pressure under control and it's pounding into your brain, stressing your heart, pounding into your kidneys,
It's going to take its toll.
It's going to take its toll, exactly. It's going to do damage that's tough to reverse. It's going to be harder to control. So we want to catch people early. When you start seeing rapid cycling, where regular rapid cycling is having more than 4 episodes of either mania or depression in a year, ultra rapid cycling is the next step of loss of control of emotionality. That you may have within the same day as the author was describing, or within
Right.
days of morning terrors, nighttime elations, extremely disruptive. But if you catch people in the beginning, get them the right diagnosis, carefully follow them, work with them and their family members, warn them of the things that, even if they're trying hard, can precipitate an episode, then you can maybe avoid these late complications.
One of the things Dr. McEvoy said earlier to me was that, you know, that support system is so important, and that plays into the whole treatment and being able to manage and live with bipolar.
Absolutely. When when I see someone with bipolar disorder, I strongly recommend and sometimes enforce that we have to have a family member or another important other in the room. I'm not talking about people's secrets. I'm talking about a biological illness. I want everybody to understand.
Right.
I want to talk with them about making sure the medicines are on the dinner table. Salt, pepper, your medicines, Texas Pete's hot sauce,
Yeah.
you know, every night, so that you remember to take them.
Right.
You have to take your medicines regularly. I tell them about the things that can cause trouble. Changes in biological rhythms. If you are taking a trip to Japan and you're going to shift time, greatly increase risk for an episode to occur. Even in small shifts like Muslim people have with Ramadan, that they fast during the day, eat at night, stay up a bit later, the rate of bipolar episodes increases. So you have to be very careful about routine.
Routine is important. Well, Dr. McEvoy, I wish that we had so much more time because you're so fascinating to listen to. Thank you for helping shed light on bipolar. And people, I mean, you see people at the medical college, I suppose.
A lot of them do really well.
We can find you. We'll have Dr. McEvoy's information on our website, which you can find at WJBF.com. Just click the Jennie link. Thank you again for being here.
Thank you so much.
Coming up, looking back at Georgia Collier Scott's amazing century-long life.